Hello and welcome. My name is Kelly McLeod. My pronouns are she, her, and I am a social worker with the Provincial Preschool Autism Clinical Intake and Care Coordination Team. Welcome to part two of our series on navigating funding programs and resources. The goal of this series of videos is to provide caregivers with information about funding programs and community resources that may be helpful in managing financial costs that families experience when caring for children diagnosed with autism. In today's video, I will be sharing information about some provincial programs that are available to help families. If you're interested in learning more about programs offered through the federal government, please watch part one of this series, where we provide an overview of benefit programs and financial supports that are available through the federal government of Canada. People diagnosed with autism have different preferences for how they wish others to refer to them. Some people prefer identity first language. I am an autistic person. While other people would rather use person first. I am someone with autism. To respect these different preferences, we use both identity and person first language throughout this series of videos. Before discussing programs and supports that are available, it is important that we first clarify the programs and financial supports that we will discuss in this presentation are not provided or administered by the Provincial Preschool Autism Service, IWK Health, or its partner organizations. This presentation is for information purposes only and does not constitute financial, legal, or tax advice. Please speak to your bank, financial supports, Canada Revenue Agency, and similar professionals if you are seeking advice about your family's specific situation. The purpose of these educational materials is to support you to understand available resources and guide you through the application process when possible. Provincial Preschool Autism Service and our partner organizations do not make decisions about program approval or eligibility. Please consult the appropriate service providers for the most up-to-date information on all programs. In part one of this series, we reviewed some things to keep in mind when you are researching and applying for different funding and benefit programs. And we will review these things again here. Before you apply for any program, make sure you have the most accurate and up-to-date information. We recommend that before you apply for a program, you contact the organization directly to ask about eligibility and to gather more specific information about the program. Some questions you could ask when calling are: is the program based on family income? If yes, what is the income cutoff? Does the funding need to be spent on a specific type of item or service? Is there a time frame for when I need to spend these funds? Is funding provided upfront, or do I need to pay for the item or service first and then be reimbursed? Are there any other limitations or rules about how and when funds need to be used? Will I need to complete an application form, and where can I find it? And finally, what documents do I need in order to apply for this program? Gathering this information upfront can help you determine beforehand if your family is eligible and whether you have what you will need to complete an application. In today's video, we will discuss three programs available through the provincial government of Nova Scotia. These programs can provide some financial assistance to families of children with disabilities. We will also review funding available to Indigenous children with medical and healthcare needs. The programs that we will review today are the Direct Family Support for Children program and Enhanced Family Support for Children. Both of these are offered through the Nova Scotia Department of Opportunities and Social Development's Disability Support Services. We will also provide a brief overview of Nova Scotia's Income Assistance Program, which is also offered through the Department of Opportunities and Social Development. The last program we will review in this video is Jordan's Principle. Jordan's Principle is a program available to Indigenous families in all Canadian provinces and territories, and it is intended to help ensure Indigenous children have timely access to needed healthcare and supports. We have included QR codes for each program on the slides. Scanning the QR code will take you to the program's website where you can get contact information and more details about eligibility requirements in the application process. Just like in part one of this series, we will give you some ideas about where you can get additional support navigating these and other resources for your child and family if needed. Direct Family Support for Children, or DFSC, is the first program we will discuss. Direct Family Support for Children helps eligible families to pay for respite care and relevant supports for children who have been diagnosed with a physical or intellectual disability and who require significant supporting care. Respite care and respite care providers are paid caregivers. Families will often hire respite providers when they need some extra help in caregiving responsibilities or to have a short break from caregiving responsibilities. The Direct Family Support for Children program does not provide respite care services directly to families. What this program can do is provide funding to help families pay for respite care. It is up to the family to find and hire the respite care provider and to schedule times for respite care for their child. Respite care can be expensive, and this program can help reduce some of the costs of these services for families. The Direct Family Support for Children program is intended to help families with the costs of respite and relieve some of the caregiver burden so that people with disabilities can remain living with their families. The eligibility criteria for this funding program are outlined on the Direct Family Support for Children webpage of the Department of Opportunities and Social Development website. We've included the criteria that were publicly available at the time of this recording to give you some idea of what is needed for families to be eligible to apply for this program. Please visit the website or call the Department of Opportunities and Social Development to make sure you have the most up to date information if you are considering applying for this program. At the time of this recording, eligibility criteria for families to apply for direct family support for children included being the parent or caregiver to a child under 19 years of age. The child lives with you and you are the child's parent or legal guardian. Your family are permanent residents of Nova Scotia. Your family income does not exceed the maximum income level allowed for this program, and that information can be found by visiting the program's website. Your child should be diagnosed with physical, developmental, or intellectual disability, and you are able to provide recent documentation from a healthcare professional that confirms your child's diagnosis and details about how it impacts your child's daily functioning. While there are many children with autism who meet this eligibility, a diagnosis of autism is not enough to be considered or approved for direct family support for children. You will require additional documentation that can speak to how your child is impacted in their daily life. If you think your family meets the eligibility criteria, please consider calling Disability Support Services at the Nova Scotia Department of Opportunities and Social Development to ask for more information. You can also scan the QR code on this slide, which will take you to the Direct Family Support for Children webpage. Enhanced Family Support for Children, or EFSC, offers additional funding to eligible families when their respite care needs exceed what funding is available through Direct Family Support for Children. Enhanced Family Support for Children does not cover full time in home support, and it cannot be used to compensate parents or primary caregivers. It must be used to pay for additional respite care from a respite care provider. Families who wish to apply for this additional funding need to provide recent documentation from a licensed medical professional or healthcare clinician about the level of care needs required for your child and be able to show the cost for that this care exceeds what is already provided for by direct family support for children. Families can also apply for this support if they are having trouble accessing the care they need for their child within their community and need access to additional funding in order to access the care that their child needs outside of their community. If you want more information on enhanced family support for children, please scan the QR code on the lower right of this slide or call the toll free number below the QR code. If you are already receiving direct family support for children and want to apply for enhanced family support, you can reach out to your child's care coordinator through Nova Scotia's Disability Support Program. The last provincial government program we will discuss here is the Income Assistance Program. Income assistance is a program offered through the Nova Scotia government to help individuals and families who are experiencing financial need. Income assistance is not a program specific to families of children with autism or disabilities. Nova Scotia's Income Assistance Program is a support available to assist individuals and families who do not have a source of income or the income they are receiving is not adequate to meet the family's basic needs. Although income assistance is not specifically intended for families of children with disabilities, we know there are families struggling to make ends meet and who need income support. This is a stressful situation to be in for any family, and especially when you are caring for children with disabilities who have specific care needs. Should your family be in a situation where you're in need of income support, the Nova Scotia Income Assistance Program could be something that can help your family manage and provide some financial stability while you work on a long term plan. In order to be eligible for income assistance, you must be a resident of Nova Scotia, have no source of income, or your income is inadequate to meet your family's basic needs. Financial need is calculated by considering the amount of income your family earns and your family size. Information about these calculations and how financial need is determined by income assistance can be found on the income assistance webpage. If you're interested in applying for income assistance, you can contact your local Department of Opportunities and Social Development office, or you can also call the toll-free number provided on the bottom right of this slide, or scan the QR code to read more information about this service. The final program we will discuss in this video is Jordan's Principle. Jordan's Principle is a funding initiative available to help Indigenous children receive healthcare supports when they need them. Part of the goal of this initiative is to help ensure Indigenous children have equitable access to healthcare supports and to reduce healthcare disparities that have negatively impacted Indigenous children and families. This program is available to children of any age who are registered or have parents who have registered Indigenous status under the Indian Act of Canada. You can scan the QR code provided, which will take you to the website for the Union of Nova Scotia Mi'kmaq, where you will find more information about Jordan's Principle and links to start an application to request funds. In order to apply for this funding, you will need to provide documentation or letters of support from a healthcare provider, elder, or knowledge keeper that outlines the support or service that your child needs funding for. If you need help navigating the application process for Jordan's Principle, please consider reaching out to your healthcare provider or request support from the Mi'kmaq Indigenous Patient Navigator in your health zone. These navigators are present in all 4 health zones across the province and can support you with navigating the Jordan's Principle program and other healthcare services your family may need. If you are a caregiver looking to apply for one of these programs, you will need to have certain documents to include in your application. We reviewed this information once before in part 1 of this video series, and we will review this information again here. Some documents you will want to have on hand And consider including in your application are copies of your child's autism assessment report completed by a licensed healthcare professional, such as a psychologist or developmental pediatrician. Your most recent notice of assessment from Canada Revenue Agency, proof of income, such as a recent pay stub, a letter from your employer, or income statement, your child's MSI healthcare number and expiry date, documents indicating indigenous status, personal banking information, reports you may have from licensed clinicians who have recently worked with or completed an assessment with your child, such as an occupational therapist or speech language pathologist. Letters of support from care providers, community health navigators, elders, or knowledge keepers may also be helpful with certain applications, depending on what information is being requested. Remember that autism affects all children differently. A diagnosis of autism alone is not enough for a child to be eligible for these benefits. You usually will be asked to provide recent documentation of how your child's daily life is impacted and the formal and informal care that they require. Keep copies of these documents together in a safe place where they are easy for you to find when you need them. That will make the process of applying for different funding and benefit programs more manageable and less time consuming. If you need to apply for or renew your child's health card MSI number, the QR code on the top right of the slide will take you to the website where you can do this. If you're looking for information on how to apply for Indigenous status in Canada, you can scan the QR code on the bottom right of the slide and it will take you to the Government of Canada website containing that information. It is not unusual for caregivers to feel overwhelmed when trying to navigate the different programs and resources your child may need. Caregivers are juggling a lot. You're learning about your child's needs and strengths and the services that best fit for your family. And it is understandable to feel overwhelmed sometimes. While it can be a lot of work up front, learning about different resources and applying for these programs can provide some help and relief in the long run. When you're feeling overwhelmed, there are people who can help you navigate these different programs and supports. Depending on your situation, consider reaching out to your family doctor, pediatrician, or other healthcare providers and clinicians who are working with your family. IWK and NS Health have Indigenous patient navigators who can assist Indigenous families with navigating different resources and services. Nova Scotia Early Childhood Development and Intervention Services is another resource that can help if your family needs additional support. Nova Scotia Early Childhood Development Intervention Services, or NSECTIS, have offices throughout Nova Scotia and provide early intervention and support services to children and their caregivers. Autism Nova Scotia is another organization that has chapters across the province and offers programming and support for autistic individuals and their families. Families living in Nova Scotia can also get help navigating services by calling 211 or connecting with your local community center. If you are a family that are newcomers to Canada, consider connecting with a local newcomer organization. This concludes part 2 of navigating funding programs and resources, information for caregivers. Thank you so much for joining today. I hope the information provided was helpful to you. If you would like to learn more about programs and resources that are available, please join us for part 3 of this series. If you're interested in learning more about supporting your preschool age child with autism, please have a look at the videos in our autism education series on the Provincial Preschool Autism Services website. So long, and thanks again for joining.